live and direct from anywhere in the world. It's The Kelly Show with Dr. Kelly Mondesire.
Welcome back to The Kelly Show, real people with real stories in real time. And this is number 3 of a series this June from my adventure to Maynooth University, which is just outside Dublin, Ireland, for the 4th International Digital Health Summer School. And while I was there, not only did I speak, however, I emceed an award ceremony and hosted several expert panel discussions on AI in healthcare, the future of digital health. It was spectacular, folks. But this next panel discussion, which unfortunately we ran into technical difficulty while there is only audio, sorry, but you don't want to miss it because this is all about AI for health. Now, who are the guests? Well, you're just going to have to stay tuned and have a listen because you don't want to miss this. This is the who's who in AI for health globally. So, much ado, Kirsty, take it away. And welcome back to The Kelly Show, real people with real stories in real time as we continue our 4-part series here at the 4th Annual Digital Innovation Summer School here at Maynooth University in Maynooth, Ireland. And today we have another amazing expert guest panel to talk about AI in health. So, starting over here, I will start with our first guest. Dr. John Sheehan is a consultant, clinical radiologist, healthcare innovator, and builder working in the intersection of medicine, technology, and system design. He combines clinical practice with leadership roles across digital health, education, and industry with a focus on applying AI and data-driven approaches safely in real-world care. His work centers on improving access, quality, and efficiency in healthcare by translating proven innovation into routine clinical practice. John, thank you for joining us today.
Thank you very much. Delighted to be here.
Alrighty now. Okay. And my next guest is, I hope I get this right, my friend, Dr. Mahan Balasubramanian. Did I get that right, sir?
Yes, you did.
Okay, thank you. Is a senior health systems and integrated healthcare leader at Flinders University in Adelaide, Australia. With more than 15 years of international experience in health systems research, workforce redesign, and digital innovation. His work focuses on using AI and integrated care approaches to reduce fragmentation and improve outcomes for people with chronic conditions such as oral health, mental health, cardiovascular disease, and cancer. He has contributed to national and international reform through collaborations across the Asia-Pacific region and beyond. He brings a practical systems-level perspective to the future of healthcare. Thank you for joining us, sir.
Thanks for having me.
You've come a long way. Yes. How many hours from Australia?
23 and a half, I believe.
Yowza. Okay, and our next guest here is Jivantika Lingalwa. Did I pronounce that right, please? Okay, thank you. Is the head of AI business applications and digital transformation at HCS Ireland, where she leads enterprise AI and co-pilot transformations across healthcare, life sciences, and highly regulated sectors. She works closely with clinical, operational, and executive teams to translate AI capabilities into real-world impact with a strong focus on governance, data residency, and responsible AI. She is also the founder of International Women in Tech Ireland and an active mentor in the European tech ecosystem. Thank you very much for joining us today.
Thank you so much for having me here.
Oh, thank you. So, stay tuned. We'll be right back after a word from our sponsor, and we'll get this panel discussion well on the way. Be right back.
This portion of The Kelly Show is being brought to you by White Wolf Advisory Services. We are the bridge between nations, creating growth, commerce and collaboration between cultures. Contact us today for more information.
And welcome back to The Kelly Show, where we have an amazing expert panel here to discuss AI in health. And let's get it going straight away. Mr. John Sheehan, Dr. John Sheehan, has brought this topic to the table for comment and discussion. John states, healthcare today often feels like a series of disconnected steps where patients move between services but experience delays, repetition, and frustration along the way. What's changing now is the ability to connect these touch points into a coordinated, patient-centered journey with AI acting as the orchestrator that brings clarity, speed, and flow to care. Okay. Jivantika, would you like to comment on that, please?
So I think it's very important today that we are discussing AI in healthcare, because as we all saw what happened today and people were talking about why AI is important. And I've also seen that healthcare is one of the important ecosystem right now where AI can be shown as a huge impact in terms of data, because as John, you've also mentioned that currently the healthcare system has the most complex data ecosystem. It's not a simple system. And I think AI is solving that issue today by removing that complexity around the AI data and the data governance piece, the security as well. So absolutely, I agree to each sentence that you have said around the AI piece in the healthcare.
Okay. Madhan, comments?
Well, I think AI, as we start to think about it, the term AI has been here all the way from 1955. It's been there for a long period of time. And I think over the period, if you start looking into it historically, there's been substantial developments into what AI actually is and how it's been used in the healthcare system. But I think it's only now over the last 10 years or so, there's been an exponential leap into how we actually use these AI solutions. And I think a large proponent of it goes to large language models. And also building artificial solutions in terms of robotics, in terms of actually having robots actually working in aged care facilities or maybe in clinics. So I think that's where the future actually is. And I believe that's a focus that would be paramount for us to actually look into. And also, I think one of the most important things that I wanted to mention is patient-centered care. And when you start thinking about this human phase of AI, it becomes extremely important for us to understand what the patients actually want.
Okay. John?
Yeah, thanks. And I think it's really important in life, no matter what area or industry you're in, is that in a complex system like healthcare, it's really important to simplify things. And often to go back to first principles. And if you look at what the basic principle of healthcare is, it's really about people, and it's about being healthy. And in fact, actually, it's actually not necessarily about treating illness, it's also about keeping you well in the first place. So the system as it exists today is incredibly complex, as we've mentioned, but you can't digitize a broken complex system.
Yes.
So I think going back to the design and architecture of it, no more than, say, the semiconductor industry, it's a highly architected system from beginning to end. And healthcare really has to be looked at it from a workflow perspective to try and understand the complexity, but actually sometimes you've got to just simplify it and go back to those first principles. So I think we focus on the patient, one symptom, one patient, look at the vertical stack of actually how all the various different digital components can assist that journey. And obviously AI is part of that, but you can't have AI amplifying a broken problem or a broken system, otherwise chaos ensues. So I think with technology, we need to have those 3 C's that I mentioned earlier on today. We need to be curious, we need to be cautious, and particularly in healthcare, we need to be compliant. So I think we've got huge opportunity to solve big problems, not necessarily right now today, but as we plan to actually figure out how to actually simplify the thinking of that and really redesign our thinking as we approach the future.
Wonderful. I can only speak from the American point of view, and I have to say, coming from New York, and also now in the Savannah, Bluffton area of South Carolina and Georgia, we are privy to apps. And from the time we make an initial appointment, we can choose on the app or online which physician we would like to see, what their availability is. We do the intake form, sign all the consent agreements, all online. And the beauty of the system that we have over in the States is most of these healthcare communities are integrated. So the Epic speaks to other systems. So all the MRIs, all your records, all your labs can be downloaded seamlessly into, say you're moving from New York City down to Savannah, Georgia. All that information goes into that hospital system seamlessly. You have your appointment with your doctor, you take the bloods, the CBCs are available, the results are available in less than 24 hours, and you have that. And if you know what all that means, as I do as being a physician, it's great because I can go all through that and I can have an educated conversation when I see the physician. The follow-ups, the surveys that they send all on the app or online, and the follow-up appointments, and how are you feeling, all this is AI driven. And I think the reason why it really works in the States is because it was built from ground up, and we didn't take something that already existed and not in such a great format. We built it from scratch, and I have to say it's truly remarkable. It's truly remarkable. So from my understanding what's happening here on the other side of the pond, you folks are a little bit behind, and I agree with you, John. You can't build up on something that's not a good foundation in the first place.
Sure, and I think no system is perfect on either side of the Atlantic. In Europe, it's now legal that you should have access to your data, and also that you can share your data and that it can be integratable with other systems. So that's actually a basic right now of Europeans, and that has to be applied. So we need that legal enforcement and pressure on countries and systems to actually integrate, because unfortunately people have so many conflicts of interest and money and all of those bad things, unfortunately, that can poison the well of health. So we need to stand up for our own rights, and data is personal, but it's also growing not only volume but in terms of velocity that's coming towards healthcare workers like ourselves, who are trying to ultimately make decisions to improve outcomes. And physicians like ourselves are getting decision fatigue, and we need AI to make us have empowered decision making and augmented
there you go.
decision making.
Yes.
And we need to be able to be not just high tech but high touch. And I think, as Eric Topol said in DeepMind, it does give us that actually paradoxical opportunity to actually have more human time with our patients, which is actually so critical for us as a human being, to have that connection and let the technology look after the complex stuff, but let also the humans really embrace each other to nourish not only the mind and body, but the spirit.
Yeah. Well said. Well said. We need to move on. We could talk about this for hours and hours, and we'll have to do that later on this evening. But let's move on to the next statement. Jivantika brings to the table. Let's see. AI is moving from experimental pilots to real clinical and operational use in healthcare. Let's discuss practical applications, trust, governance, data privacy, and the conditions needed for AI to truly augment clinicians and improve patient outcomes rather than add complexity. And this is a nice segue to what John has just said. Yeah. So, Madhan, what would you comment on that?
I would like to first pick on a point that actually came up from one of the talks at the digital school yesterday. There were a group of nurses who were actually from Malawi in Africa, who were actually carrying buckets of water, and they enjoyed the conversation and also the atmosphere that actually brings them together. They actually liked it more in the presence of being there. They're providing a more advanced solution is probably not the exact way to go. So getting to the point over here, an AI should actually serve the purpose. An AI should really understand what the people actually want. So I think the core point of the matter over here is that health equity. Is AI addressing one of the quintuple aims of the healthcare system, which is health equity? Is it really providing the necessary steps required to bridge this gap, which is actually coming from various disadvantaged populations, homeless populations, culturally and linguistically diverse communities, migrant communities? Is AI addressing solutions that is scalable towards this breadth range of populations, or is AI trying to address a niche of the population that have already care which is available for them? So that is a key point that needs to be pointed out, because that addresses and goes to the core of a health system objective, that is health equity.
Oh, well said, my friend. John, comment?
As a radiologist, I look at pictures, and one of the units of measurement of the quality of a picture is SNR, which is signal to noise ratio. So I prefer when there's less noise and more signal. I can actually make a much more accurate diagnosis. I think in all aspects of life, both personal and professional, there's so much noise now, and there's so much volume and velocity of stuff crowding our minds, and we're suffering from AI vertigo. I think the best sort of technology and the best type of AI is one that acts in the background, removes that noise, and just simply provides you with pure signal to make an informed decision. And every day clinicians are burdened to make a lot of decisions on a lot of patients with a lot of time poor opportunities, and one of those big things that they order is diagnostic tests, and particularly my area of radiology is ordered quite frequently, and typically around the world 30 to 50% of the time when studies are ordered, it's the wrong test.
Oh.
Yeah.
So you're going to the doctor with a headache, and you have history of breast cancer, and your doctor orders a CT.
Yeah.
Oh.
You don't need
yeah.
a CT, you need an MRI brain with contrast. Does any doctor know that? Probably not. And ultimately that leads to delayed diagnosis, false reassurance, and potentially a poor outcome for the patient.
Yeah.
So part of the opportunity for AI is actually go in there and have AI assisted clinical decision support to figure out what your information is: female, breast cancer, headache, what is the best test for you, and make sure that the doctor knows that's the best test, and they have the opportunity then to actually choose that without all the noise about, is that what we did when I was in training? What's the easiest test to get? What did my colleagues do? What have I been doing for 20 years? Just move all that away and just go, there's the right test.
Yes. And on the flip side, the costs involved with ordering the incorrect test, and the trauma and cost of the patient and the stress there, and that compounds. My friend, your comments?
Yeah, and I just like to start on what Dr. John just mentioned around. So just on an example, like recently my mom had a small surgery, and initially it looked like a lump on her chest, and doctor was like, you know what, this doesn't need a diagnosis, and it stayed there for 6 months. And it was like a very solid thing, and they were like, maybe this is something that has caused because of age and all of that. After 6 months, it started to grow like very rapid, and within days it became like big red, and all of a sudden doctor said we'll have to do a minor cut to remove the fluid and all. On the surgery table she got 14 stitches because it actually turned out to be a major surgery out of it, and she got like a big lump of flesh out of her. So 20 days, 1 month went by, but this is because of poor diagnosis. This could have been diagnosed long time back, not wait 6 months, and she could have probably avoided that big surgery. And post that she got another like post-surgery consequences as well, which was again not diagnosed properly. So because I use a lot of Copilots, I went to Copilot, because I stay far from there and I don't know what doctors are saying on real time. So I started to search on Copilot and ask, this was the symptom, my mom went through the surgery, this is what had happened. So it was like an obese or something non-cancerous. And then Copilot just came back saying, because of the history, this is what has happened. She might have just got an infection because of it. So before even doctor told me, I could probably get a little bit of information from Copilot AI, and that was confirmed by the doctor. So I think when you said that AI is there to solve that complex problem, the patient records, the clinical stuff that we are going, that we see in real time right now. And because data is now the backbone of any AI solution, it's very important to get your data in place, like data governance, privacy, it's all, and the backbone for data is trust.
Yes.
So we've been taught from the very early age, never lie with a doctor and a lawyer. So that's the truth. The more data you give, the more history you share, the more accurate your diagnosis will be, and so is with AI. So as Madan said, that AI is there since a very long time, but now it's here to stay. It's here to actually solve real problems, bring real experimental value for healthcare. And because healthcare finances, operations, they have huge data set and it's very complex, it's very difficult to get that solution in place. And that is why we have AI, the responsible AI that we call. And I think I've been working a lot with data set recently for a lot of organizations, and the major concern that we see within those are the data privacy and not trusting their own data. So how will you implement AI? So before even implementing AI, it's to manage your data first, to have that governance and strategy in place first before even your AI can adopt to your ecosystem. So it's not artificial intelligence anymore, but I call it as an actionable insight, because it's not about technology. Again, it's about the outcome.
Well said. Well,
And may I
yes.
just add to that? I think in our lifetime we're actually in the middle of an incredible revolution that is far exceeding anything that's happened in the past, and it's also happening very rapidly. So this is all new for most of us, and we're all learning on the job, either in our personal or professional lives. And I think we are experiencing this Copernican shift of going from doctor knows best to patient knows best, from physical to virtual. However, you still need obviously a human in the loop, but you also
Absolutely.
need a professional, qualified individual in the loop. And I think it's really incumbent upon healthcare workers around the world to become much more educated and informed and reduce that knowledge gap and become much more digitally literate and approach AI with those 3 C's that I've mentioned before, which is being curious, being cautious, but also being compliant. But I think as long as you've got that curious mindset, and you're taking the Copilot or you're checking whatever AI tool you're using, whether it's certified or not, just get in there, be curious, be that cautious, compliant human in the loop. You will find it will augment you and assist you in your practice.
Okay, we have to move on now because we're going to run out of time. The last statement that we're going to discuss is Madhan brings up this. He'd like to talk about the practical examples of AI in health, particularly how it can support screening, triage, stroke pathways, and clinical decision support across oral health, mental health, cancer care, and cardiovascular care. How can AI strengthen care coordination and decision making while keeping clinical judgment at the center?
So I am not very experienced in that zone of the cardiovascular treatment and all of that, but what I certainly do know that AI is strengthening that coordination and patient record things, because now we have everything online in an app, and I can go and book for an appointment with a doctor. If I have my history with me, I can actually go and put it in the AI application, talk to AI like this is my history, because I'm curious, one of the C's, and before even a doctor tells me, I want to know myself, although that scares the thing out of me, because I am like, I want to know everything that is happening. But it's good to have that human in the loop factor where the doctor actually confirms, this is what has happened. So that gives me a sense of relief anyway. But it's fascinating to see how AI is changing that decision making process anyway, because it's very accurate. 99.9% I see that accuracy. I wouldn't rely 100% at that moment with AI, because at the end it is an AI, but having that human in the loop factor where the doctor confirms actually this is what is happening with you, that gives a sense of relief that actually AI works and you can trust on that data that the AI is providing with you. But in the end, always be cautious, always be compliant. Again, to just reiterate you, Dr. John, that without that having that responsible AI in place, without having that compliance and privacy in place, trusting your data, it's going to be getting very hard. So if you're not trusting your own data, your decision making skills are going to lag in any way, and there'll be a delay in the processes that you're working with the AI applications. So that's all I would say at this stage around that.
Okay. John?
Yeah, I think with any digital transformation and innovation, AI is pretty much the same. You want to try and achieve 4 things if you're going to adopt it. It should make things better, faster, cheaper. Actually, sometimes the one everybody forgets is happier. Because we're not happy when there's cognitive friction and dissonance and noise and administrative stuff. So if all of that can be taken out of your wheelhouse of responsibility, and you're no longer down in the weeds, you're more actually now flying at a higher level as a conductor within an orchestra, rather than trying to play the fiddle and the bongos and everything else. Just try and remove yourself, have that time to have proper thoughts, proper questions, and proper eye-to-eye contact with your patient. So I think there's so many potential use cases from conversational AI to actually workflow management, but I think that's kind of the simple approach again to how digital transformation like that can really assist us. And it's just, there's huge opportunities, and we've just got to figure out the basics before we jump into the complex.
Madeline, take the floor, please.
Yeah, so there are actually a couple of things that I wanted to point here. So one, I think you actually mentioned earlier that in the US, they developed solutions right from, the grassroots, using their own data and building native solutions. Okay, so let's just hold on to that thought for a moment. So when you start looking into AI, when you start looking into the number of studies, that have been published over the last 3 or 4 years, it's been massive. And the number of studies in healthcare that have been published using AI have been massive. But if you start looking into the studies that have really examined the cost effectiveness of a certain AI tool, it's very minimal. For example, the study that we have been working in terms of chatbots for mental health for older adults, we looked into 5,051 studies published over the last 10 years or so, but only one study effectively looked into cost effectiveness. So that is an important aspect that we need to really understand. Is the AI tool that is coming into the market, is that scalable? But for that, is it going to be cost effective? Is it really going to serve that purpose? And for that, economic evaluations needs to be included within much of the AI trials that is actually going into. So that's the key issue that I wanted to mention. Second thing is that the idea that all the systems are actually integrated and really working well in a coordinated manner, it's not something that is applicable in different countries. If for example, if you start looking at Australia, we are still stuck in electronic health records. If you start looking into India, they're still really moving on from a very early stage from paper-based records to electronic health records. So you see, the systems need to actually work together for us to really realize that the sum of the parts and the outcome that actually comes of it is really worthwhile. And for that, it's not just AI that actually adds up an additional layer, trying to actually provide this vertical integration across the different levels of the healthcare system, starting right from the patient care, starting to a clinician and services, starting into administrative and the governance. I usually see it as a triangle where digital health, especially AI over here, provides vertical integration across those layers. So that is something that we want to achieve, but I don't really believe in different contexts it hasn't been realized. In fact, in countries like in many developing countries, we are very much in early stages of realizing this dream.
Okay. Well, I want to say thank you to all of you today for participating in this panel discussion. We could go on and on and on, but we have the limit of time. So I hope we can all keep in touch with one another and continue the conversation at a later date. But folks, I want to thank you for watching The Kelly Show, and stay tuned because the next show in this series is the awards ceremony show where somebody over here actually won one of the awards. I'm not pointing to anyone, am I? All right. Well, stay tuned because this has been quite the series. Brilliant minds coming together at Maynooth University here in Maynooth, Ireland, and Stay tuned. Next week we have the award show, and in July I have another amazing guest coming on. So for right now, thank you for watching. Keep watching, share these videos, because these folks are the brilliant minds of the future of healthcare. So for right now, peace and love. Kirsty, take it away.